Our voyage begins in ancient Egypt, around 2750 BCE, where the earliest evidence of surgery, called trepanation, was found. This procedure involved drilling holes into the skull, possibly to treat injuries or relieve pressure, and sometimes for ritualistic purposes. Fast forward to the Middle Ages, and we encounter the bloodletting craze. Physicians of the time believed that draining blood from the body could balance its humours, leading to shocking scenes of patients being bled excessively and, sadly, sometimes to death. The year 1846 marked a significant milestone in the evolution of surgery. At Massachusetts General Hospital, Dr. William Morton administered ether anesthesia during surgery for the first time, revolutionizing pain management in surgical procedures. Interestingly, ether was a popular recreational drug before its medical use, inhaled at ether frolics parties for its euphoric effects. In the same century, Joseph Lister introduced the antiseptic technique to surgery. By sterilizing instruments and using carbolic acid to prevent infections, he greatly reduced post-operative mortality rates. The late 19th century saw cocaine being used as an eye anesthetic. The euphoria experienced by patients as a side effect contributed to its recreational use and subsequent addiction. During the polio epidemics of the early 20th century, the iron lung, or negative pressure ventilator, was developed. This device created a vacuum around the body to help patients breathe, aiding in recovery and saving countless lives. In 1954, Dr. Joseph Murray performed the first successful organ transplant, a kidney between identical twins, setting the stage for future advancements in transplantation surgery. 13 years later, Dr. Christiaan Barnard performed the world's first successful heart transplant in South Africa, demonstrating the possibility of replacing vital organs. The 20th century also saw neurosurgeon Dr. Walter Dandy pioneer techniques for brain surgery, including the removal of brain tumors and the treatment of hydrocephalus, thereby revolutionizing neurological care. With the rise of celebrity culture in the 20th century, cosmetic surgery became increasingly popular. Procedures ranging from facelifts to breast augmentations fueled a multi-billion-dollar industry. Advancements in technology in the late 20th century led to the development of minimally invasive surgical techniques. These methods reduced recovery times and scarring while improving patient outcomes. In the 21st century, robotic-assisted surgery emerged, allowing for greater precision and control during procedures. Robots like the Da Vinci surgical system have become increasingly common in operating rooms. In 2005, the world witnessed its first partial face transplant performed in France. This groundbreaking achievement in reconstructive surgery offered hope to patients with severe facial disfigurements. Throughout history, surgeons have made remarkable strides in limb reattachment surgery, with cases dating back to ancient times and advancements continuing into modern medicine. In recent decades, transgender surgery, including gender confirmation surgeries, have become more accessible and refined, providing essential care for transgender individuals seeking to align their bodies with their identities. In conclusion, the evolution of surgery is an inspiring tale of human ingenuity and perseverance. From trepanation in ancient Egypt to groundbreaking organ transplants and robotic-assisted procedures, the field has continually pushed the boundaries of what's possible, forever changing the course of medical history.